welcome back to The Big Picture. We are talking about something I don't really love, and that is mosquitoes. But joining us right now, Zach Holbert-Watson, you are with Franklin County Public Health, and your whole job is tracking mosquitoes and the diseases they carry. What are you seeing this season when it comes to the mosquito pools throughout the county?
So we are seeing slightly more infected mosquitoes than is typical for this time of year, but we're also seeing a higher abundance of mosquitoes. So they're out there, they're biting. Protect yourselves, wear insect repellent.
Right, and really doing your part to control the mosquito population is pretty easy. It comes down to just kind of managing water around your property.
Yeah, you want to be diligent about removing any potential breeding sources. That's any standing water that is persistent for more than 5 to 7 days. So think of things like bird baths, the little saucers under plant pots. Make sure your gutters are clean. If you have a rain barrel, make sure there's a screen in it, throw a dunk in it. You can get those at any local hardware store. And if there's any persistent source of standing water that you can't easily remove, go ahead, give us a call. We'd be happy to come out, take a look, and treat it if necessary.
Absolutely. So when we talk about the West Nile virus, we know some mosquitoes in the county have tested positive for it. What is the probability of someone in Franklin County, when they get bit by a mosquito, maybe contracting that virus?
I would say it's pretty minimal. Just for reference, last year we collected 824 West Nile positive pools of mosquitoes, and we had 1 human case of West Nile virus.
Wow.
So we really are doing as much as we can to interrupt that transmission cycle, prevent people from being exposed to the virus. But if you do happen to be exposed, in a vast majority of cases, the illness is pretty mild. So it would be rare that you would have any severe symptoms.
And some of that, that probability and just the case numbers in general comes down to how the county public health manages the mosquito population and the general, county system as a whole. What does that look like?
So it starts with surveillance. We have a pretty robust network of surveillance sites. We set around 150 mosquito traps all across the county every week from the middle of May through the end of September. And any mosquitoes that we collect that are capable of transmitting West Nile virus, we do test them to see if they're infected. And if they are, that is when we would schedule a spray for an area. So you can see the current spray schedule on our website, mosquito.myfcph.org. And in addition to that, we also we have a team of technicians who are constantly looking for those sources of standing water, so that they can treat those standing water sources and prevent any mosquitoes that are in them from becoming the adults that fly around, bite, and potentially transmit disease.
Now, I'm just curious, but is there a specific area in Franklin County that tends to have more mosquitoes than others besides just a general area with a pool of water?
So in addition to our spray schedule, we also have a surveillance dashboard on our website that tracks the total number of mosquitoes caught in the different areas around the county. I think right now we're seeing a lot of mosquitoes in kind of like the southwest side and also in the south. Generally, the southern half of the county tends to breed more mosquitoes than the northern half.
Okay, very interesting. And so what are some of the biggest mistakes people make after they get bit or for protection?
So I would say some of the biggest mistakes people make is probably not being aware of just how many potential breeding sources there are in their yards. And again, if people are having mosquito issues, we'd be happy to come out and kind of evaluate, give them some tips on things that they can do to reduce potential breeding sources. I think a lot of people also aren't aware that they should really be wearing insect repellent every time they go outside. And you want to make sure that you're using a repellent with an EPA-registered active ingredient like DEET or picaridin or oil of lemon eucalyptus.
All right. Oh. And anything else that folks should know? Because, we've still got a few more months to hang out with these mosquitoes before it gets cold.
Will their population keep growing over the next couple weeks?
So typically we see the big spike in population right around the end of July, beginning of August. So it's kind of we're kind of in that darkest hour before dawn right now. And then the population will start to taper off as we get into the second half of August and into September. But that is when the infection rate is highest. So don't rest on your laurels. Keep your personal protection up, and yeah, we'll all make it through this.
All right, Zach,
Okay.
thanks so much.
Thank you.
Thank you.